Repeated dry cough worse at night, relieved by bronchodilator, is asthma. It's quite common pediatric problem. 15% around children has asthma. They remain undiagnosed, unaddressed, untreated. So, how do you treat asthma? You have the relieving drugs like your salbutamol and albuterol. You have dose like 3 to 8 times daily in nebulized and inhaled form, not in oral form, because nebulized and inhaled form directly goes to the lung and they work faster and effective release is there. If you give orally, the drug will be absorbed in the blood and little amount of it will come in the lung, whereby thereby there will be less amount of activity of the drug. So you give always in inhaled form and nebulized form. You have rescuer drugs like your prednisolone, 1 to 2 milligram per kg per day in 2 to 4 doses. And finally, antibiotic is also needed at times, good amount of time should I say, because secondary infection, pneumonia is quite common, throat infection is also common. So antibiotic is given usually orally, but in severe case, severe pneumonia, if patient qualifies the definition of severe pneumonia with the fast breathing criteria, above 2 years, 2 months to above 1 year is 40, and above 2 months, 2 up to 12 months it is 50, and below 2 months it is 60 respiratory rate per minute you give parenterally. And then you have preventer medications like inhaled and nebulized corticosteroids and montelukast. The first one obviously is the best one, good good preventer. So in doing so, you treat asthma through modality of asthma treatment is using the relieving drug when the child has attack and giving the preventers for long time and 3 month interval assessment when it is decreasing and the disease is controlled, and you step down to the you quit one and then quit the other one, then ultimate dose reduction, and finally you quit the medications. And when there's fresh attack, you restart every medications. If you vaccinate annually, your with influenza vaccine and pneumococcal vaccine, you will have less amount of secondary infection and less amount of morbidity as well as mortality. Ultimately, in childhood asthma, they do recover and they do not leave any sequel in the lungs, and outcome is very happy. The in between, if you treat properly, the prospects, the quality of life, everything remains well.